Okay. So hello everyone, I'm Dr. Ayush Pandey and welcome to this interesting course on the fellowship in dermatology. So in this session, we'll be speaking about the basics of skin, basics of dermatology. We'll be talking about the structure, function and development of the human skin. And then we'll be talking about what are the layers and what exactly is the classification. If we talk about the epidermis, dermal layer, subcutaneous layer, dermoepidermal junction, dermis and subcutaneous layer. Then a brief discussion about the immunology and genetics of the skin, and then some talk about the epidermal kinetics, lipids of the epidermis, and percutaneous absorption. So this whole session will be around the basics of dermatology. Let us go ahead. So what exactly is the structure, functions and development of skin? So as you know that skin is the largest organ of the body. Yes. So this is the largest organ and the primary role of skin is it acts as a barrier. Barrier to what? Barrier to any microorganisms, barrier to infections, any outside, environment particles. So it forms a layer of covering between your inside of the body to the outside atmosphere. So primary, the outermost layer of the skin is composed of keratinocytes, which secretes keratin. And again, it is further subdivided into strata. Is present only in thick skin. And where exactly we know we have the thick skin, especially in the palms and especially at the soles. So the layer of the skin is thick when we talk in comparison to the other skin surface. Most important components of the integumentary system. So we have already discussed the layers and again some, two, three more points about each and every layer of the epidermis. So the basal or the deepest most part of the epidermis or the basal layer of epidermis, it is called as stratum basale and it contains single layer of columnar or cuboidal cells. Components are being there, so thereby it plays an important role in structure support, nourishment because of that glycosaminoglycans and all kinds of glycoproteins which are being there. It acts as a nourishment. Sensory perceptions contains receptors for touch, very important, Meissner's corpuscles and Pacinian corpuscles. Thermoregulation because of all kinds of blood vessels and glands which are being located. Immune defense contains the important cells like mast cells, macrophages, and it plays an important role in wound healing because it contains fibroblast that plays a crucial role in tissue repair and scar formation. More than a structural layer, yes, it is a dynamic multifunctional layer and it has a lot of role like thermoregulation, immune, nourishment because it is very highly vascular. It contains all the important artery, vein, nerves, all the lymphatic supply is being there. So any damage can, lead to scarring and all kinds of wrinkling, aging takes place through this second component, that is the dermal layer. The third is the hypodermis, and this is the subcutaneous tissue, and it is being composed of adipose and connective tissue. Social role is the majority component of this base of the part of this which is being there of the skin. The lowermost part, that is the hypodermis, again important, if we talk about composed primary of adipocytes, loose connective tissue, contains fibroblasts, collagens. So, this clinical correlation, if we talk about lipodystrophy, abnormal deposition, any kind of cosmetic procedure. So this then becomes the important part of it. Coming to the third, that is the immunological aspect of the skin and the genetics of the skin. So it is, if we talk about the skin as a whole per se, it is not just as a largest organ if we see, it is also one of the highly active immunological and genetic organ or genetic interference. Because why? Because it is the first line of contact. So any kind of environmental pathogens, barriers which we come across has to cross the skin and then penetrates forward. So once they reach the upper layers, dead corneocytes are being shed off from the surface and they are being balanced equally by the proliferation. So continuous production and destruction of this process takes over. And if you have to understand the psoriasis in which there is accelerated turnover of the cells, thereby leading to a lot of, thickening or scaling or parakeratosis. Provides mechanical resilience and barrier properties, and clinical correlation is, of course, a variety of these three dermatological conditions like ichthyosis vulgaris, pemphigus vulgaris, and atopic dermatitis. So there is a transcellular route or intracellular route which occurs, directly passes through the corneocytes, favors small moderately lipophilic modules. Intercellular through the cells, diffuses through the lipid bilayers, and you have a transappendageal. What are the appendages? Like hair follicles, sebaceous glands. Particles, liposomes, microneedles, ionophores are under investigations. Why? To enhance the delivery of the drug. So a lot of, research has been going on because percutaneous absorption is definitely a, complex process. And a variety of factors play an important role in percutaneous absorption, like skin barrier, drug characteristics, and external factors. So hereby I end my presentation, and this was all about the, overall anatomy and physiology of the skin, which has to be understood for before we go into the core dermatology section.